Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 compression fractures occur every year. Most of these are due to osteoporosis, and a lot of them go unnoticed and have no pain. 50% of women and 25% of men will have an osteoporotic fracture in their lifetime. Once a vertebral fracture occurs, the risks of additional compression fractures in an adjacent vertebrae increase fivefold. The symptoms of a compression fracture are typically nothing, but they can include a sudden onset of back pain that worsens while standing or walking, limited spinal mobility, and if you get subsequent fractures above or below, you might start getting height loss, deformity, and disability. Here's the downward spiral. You get spinal fractures, you start to have back pain from it. You have more fractures, you end up getting spinal deformity because you start to bend forward with what's called kyphosis. This pushes on the lungs, so you get decreased lung capacity, which impairs a person's function. They start to lose appetite because it impinges on the stomach, and it can affect sleep, decreases a person's activity, which then leads to more osteoporosis, increases the fracture risk significantly, and all in all, you end up getting a 23% increased mortality. Treatment options for a compression fracture: if it's not hurting too bad, it could be simply benign neglect, maybe some medication or whatnot, but you can't just kind of watch it. Medications that are available include over-the-counter ones such as nonsteroidal anti-inflammatories and Tylenol, narcotic medications, muscle relaxers, as the fractures sometimes cause spasms and aching, and then spinal bracing. What you see here is called a Jewett brace. It comes across the chest, around the abdomen, and then in the back. So it's 3 points of compression, and it can give a lot of relief. There's also a TLSO brace, which actually covers pretty much the whole front and back. That can give excellent relief as well. In the 1980s, the vertebroplasty procedure was invented for the treatment of compression fractures due to cancer. It worked very well, so in the 1990s it actually began being used for regular osteoporotic fractures too. It's an outpatient low-risk procedure that provides instant pain relief in about 90% of cases. This is looking down at the vertebral body, okay? These are the pedicles, this bone, and this bone. This is the spinal canal. So what a pain doctor will do is put the catheter through the pedicle, because that's a safe zone, okay? And then they might do that unilateral or bilateral, and then under fairly high pressure, bone cement is injected into the fractured vertebrae, okay? And it hardens within about 20 minutes and can give instant relief. Kyphoplasty is actually an evolution of the vertebroplasty procedure. It was FDA cleared in 1998. It began to be very popular about 5 years after that, and that's continued to this day. It's similar to a vertebroplasty in that it does involve bone cement. It involves catheters being put into the fractured vertebrae. However, the big difference is that it involves placement of a balloon first, filled with saline to open up a void, pushes the fracture fragments out of the way. Here's the outline. So one is the catheter is inserted, this is looking from the side, through the pedicle into the vertebral body. And usually it's done bilaterally, okay? Then the saline is input through inflating the balloon, okay? And that pushes the fracture fragments out of the way and creates a bony void. So you have usually bilateral, so you have two bony voids in the fractured vertebrae. And you see how you have loss of height here, but you start to get the height back with the balloon. Then you fill that void with the bony cement under low pressure, and then once it's filled, the procedure's done, and the bone cement hardens within about 20 minutes. Well, what are the outcomes? Typically, it's immediate pain relief from the stabilization. It's like an internal splint. Aches and spasms may continue for weeks, but most pain resolves right away. Several studies have shown over 90% of patients seeing dramatic pain relief immediately with significant increased function, including walking and performing activities of daily living. There have been studies showing questionable benefit. They are far outnumbered by the ones that show incredible pain relief. I mean, this is an outpatient procedure. It takes about 30 minutes, 60 minutes at the most. Most patients can go home the same day, and to get that kind of an outcome is unreal. There are some slight risks to the procedure. These may include the typical infection, bleeding, nerve injury, possible anesthesia complication. A rare complication is when the bone cement goes somewhere where it shouldn't go, okay, into the spinal canal, for instance, and there can be devastating complications, but those are unusual. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options, such as Kyphoplasty. The board-certified award-winning doctors have exceptionally high success rates. Visit us online today at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.